Welcome to our training on preventing and controlling the spread of communicable diseases, including immunizations. These are current health practices that you can follow in an early education setting or an after-school program. My name is Tim. Most of you know me as Tim the Trainer, and we're going to do a comprehensive review of the requirements for maintaining a safe and healthy environment. Before we get started, let's go over some training tips. First, I would recommend that you have a current copy of the Child Care Minimum Standards available if possible. If you don't have a current copy of the Child Care Minimum Standards, that's fine. You can definitely follow along with the training material, but it's important for you to be able to see exactly where these expectations are coming from and what you need to do to stay in compliance with child care regulations. Be sure to take notes so that you can discuss these processes and practices with your center director, working together as a team so that you can ensure a safe and healthy environment, not only for the children that you care for, but all of the adults that are also present in your building. Reach out to me, Tim the Trainer, if you have any questions about the training material that we discussed today, or if you need more information beyond the scope of the training material. We are here for you. You can reach us if you go to our website, timthetrainer.com. In the upper right-hand corner of our website, you can send us a secure message and we can respond with answers or information. You can also email me, tim@timthetrainer.com, or you can reach us by phone at our office, and once again, we can give you the information that you need. This training today has been verified by the Texas Early Childhood Professional Development System. So if you have a personal TechPeds Workforce ID, make sure that that is entered on your profile on timthetrainer.com before you complete your assessment today. That way your certificate will automatically be uploaded into your TechPeds account and you don't have to do that manually. It usually takes about 24 hours for your certificates to be uploaded into your TechPeds account. It doesn't happen automatically, but usually within a day it'll show up there. Once you do complete your assessment, your certificate will be located on your Tim the Trainer profile immediately. Also, just remember the total number of clock hours of training that you complete in a single day cannot exceed the number of hours that you worked in that particular day. Training must be completed in a reasonable amount of time per the Child Care Minimum Standards. And also this keeps you in compliance with Texas Workforce Commission and wage and hour laws. So I have 3 objectives for you today. This is what we're really going to be focusing on as we go through this material. My first objective is to help you understand health practices outlined in the Child Care Minimum Standards and what expectations must be met. The second objective is to help you understand guidelines for sanitizing and disinfecting in order to maintain a safe and healthy environment. And our third objective that we will focus on today is to help participants understand the professional development requirements outlined in the Child Care Minimum Standards. Once again, our goal here at Tim the Trainer is always to help you maintain compliance with licensing. It's one of the most important things that you need to do for your school. Let's talk about professional development. This is what is required by child care regulations as far as professional development is concerned. And remember, this is not about just getting your hours. This is not about just checking a box off and getting this done. I really want you to reflect on how you can grow personally, how your school can grow, how you can enhance health practices. Once again, not only for the children, but for the adults that are present. This is not about just getting your hours. I really want you to listen to this material and reflect on this material on how can we make our program safer and healthier for everyone involved. So when we look at professional development, for new employees that are first hired at your facility, they must attend an orientation. The orientation has to be done within the first 7 days of employment, and it must be done before they are left alone in a classroom. Part of new hire orientation is handling, storing, and disposing of hazardous materials. So we're going to cover that in today's training. Also, new employees entering the childcare industry for the first time, or any employee that has less than 2 years of experience working in a licensed or registered program, must have pre-service training. That is a different requirement from orientation. Your pre-service must include this training that you're doing right now, preventing and controlling the spread of communicable diseases, including immunizations. Then we have the third requirement, and that is part of your annual training. So this has to be done by every caregiver in your program every single year. And that training also is the one that you're doing today, preventing and controlling the spread of communicable diseases, including immunizations. Also part of your annual training is the same thing as in orientation, handling, storing, and disposing of hazardous materials. Again, this is a different expectation from orientation. Even though it's the same training topic, it is a different expectation. So sometimes for brand new employees, they're going to do the same topic twice in the first year. When we talk about handling, storing, and disposing of hazardous waste, the training must specifically include when caregivers must wear gloves when handling blood or bodily fluid that could potentially contain blood. So kind of always keep that in mind. That is a big requirement right there. And when we talk about the annual training requirements, these are annual training requirements for both caregivers and the designated director. So let's talk about when you wear gloves, okay? Now, a lot of what we're going to go through today are the minimum requirements. I'm going to give you some recommendations on exceeding the minimum requirements in several different areas. So just kind of know that even though I might tell you what the minimum requirements are, you can always exceed, all right, in order to keep your school safe, in order to keep your children safe. Now, when we talk about exceeding, when we're talking about sanitizing and disinfecting, you can't change the manufacturer's recommendations, especially when it comes to dilution systems and mixing some of those products. But for example, with wearing gloves, you're going to see here that caregivers must follow universal precautions outlined by the Center for Disease Control, most of you know that as the CDC, when handling blood, vomit, or other bodily fluids that may contain blood, all right? So technically, you only have to wear gloves when you're dealing with blood, when you're dealing with vomit, or you're dealing with another bodily fluid that may contain blood. So if you're just changing a diaper, if you're just wiping a child's nose, technically you don't have to wear gloves in those situations. Normally, we recommend that you do, all right? And a best practice is that you always wear gloves when dealing with bodily fluid. And here's my opinion on that one. Any bodily fluid that you handle could potentially have blood in it. And blood is not always visible to the eye, okay? So even though you don't see it, it could still be there. So my recommendation is to always wear gloves when possible. All right. So when we talk about, you must wear gloves when dealing with blood, vomit, or other bodily fluids that may contain blood. This is including using a disposable glove, placing gloves contaminated with blood in a tied, sealed, or otherwise closed plastic bag, and then discarding them immediately. You might want to highlight that one, and you might want to write that down to follow up with your team. All right, because I've seen in many cases gloves that have, blood on it are just tossed in a traditional trash can. That's going to be a compliance issue for you right there. So if you have gloves that have blood on them, They have to be tied, sealed, or otherwise closed in a plastic bag and then discarded immediately. Discard all gloves immediately after one use. So you can't use the same pair of gloves on multiple children time after time again. You use it one time, you dispose of it, you get a new pair of gloves. And then always make sure that you're washing your hands after using and disposing of gloves. So just because you're using a glove does not make you exempt from washing your hands. You still have to wash your hands every single time, even if you're wearing gloves. The next, let's kind of talk about what is the definition of sanitizing. Sanitizing is the use of a disinfectant product that provides instructions specifically for sanitizing or disinfecting, and it is registered by the Environmental Protection Agency. You must follow the product's labeling instructions for sanitizing or disinfecting depending on the surface. So if you are using an alternate chemical to sanitize and disinfect your program, you're using something like Oracle, you're using something like a Nuquat, a DSD. These are some of the popular chemicals that are used in, licensed childcare facilities. Any alternate chemical that you're using must have a registration number from the Environmental Protection Agency on it, and it must have specific instructions for sanitizing and disinfecting, depending on the surface. All right? If those items are not listed, you can't use it. All right? So those are the two things that you want to look for. Does it have a registration number from the Environmental Protection Agency? And does it have specific instructions for sanitizing and disinfecting? And at that point, you're going to follow the manufacturer's instructions. If it is a chemical that has to be diluted, you're going to follow the manufacturer's instructions for diluting. This is that situation that I mentioned earlier where you're not going to exceed. You have to follow the manufacturer's instructions exactly as listed. Sometimes when we have a lot of illnesses that are going around in your program, we tend to want to supersize things because we want to really get rid of those germs and create a healthy environment, and that can cause big time problems. If you change the recipe, if you change the dilution recipe, you could end up with chemical burns, you could end up with asthma reactions, so be careful with that right there. You're going to follow those instructions exactly as listed on the bottle. You can still use bleach products. It is not recommended, and there's a lot of research, there's a lot of articles out here discouraging programs from using bleach products, but at this point in time, you can still use bleach products to sanitize and disinfect your program. If you do use a bleach product, okay, then you've got this 5-step process that you have to follow right here. Wash it with soap and water, rinse it with clear water, soak or spray with a bleach solution for at least 2 minutes, rinse it with cool water, okay, only those items that could be placed in children's mouths, and then allow it to air dry. So you notice here that if you are using a bleach product, this takes a lot of time. All right, it takes a whole lot of time. If you're changing diapers and you're having to sanitize the diaper changing surface, if you're having to sanitize toys that children have played with or could have put in their mouths, it's going to take some time. So using one of those alternate chemicals that have an EPA registration number and have specific instructions for sanitizing and disinfecting, specifically for the surface that you're sanitizing or disinfecting, this could speed up the process, all right? But I know a lot of programs that still prefer to use bleach water. If that's what you choose to do in your program, that's your choice. Just remember, if you're using a bleach solution, those bleach solutions typically only stay good for about 8 hours. Otherwise, they start breaking apart. So if you make your bleach bottles first thing in the morning when you open your facility, you're going to have to remake them 8 hours later. If you're open 12 hours a day, 6:30 to 6:30, you make your bleach bottles first thing in the morning. By the time the afternoon comes around, okay, that bleach water is not going to be good. All right, so kind of keep that in mind. That's another downfall of using bleach products right there. Another requirement that we have in the child care minimum standards is you must have an annual sanitation inspection that is done at your facility. Licensed child care centers must have an annual sanitation inspection, and it must be conducted by a local sanitation official. All right, so this is typically done by your city or your county. You are required to comply with local health and sanitation inspections, and child care licensing does require you to comply with corrections, restrictions, or conditions specified by the inspector in a sanitation report, letter, or checklist. All right, so we have two different governing bodies that is going to regulate health practices. It's going to be regulated by child care regulations. It's also regulated by your local governments. Okay, so kind of keep that in mind too. And your city or county may have different expectations than what child care regulations has. So when we look at health practices, you kind of want to look at what are the expectations in your specific area. I'll give you a good example right here. Okay, hand washing. Child care licensing does not require hot water for hand washing. All right. I know a lot of cities that do require warm or hot water for hand washing. So that would be one example that you want to check in your local area if it's required. Okay. But as far as child care licensing is concerned, if you got water, you're good. All right. Let's kind of start now and go into steps to ensure a healthy environment in your program. Okay, so the first thing, and y'all, this right here is where I really want y'all to be thinking outside of the box. Okay, don't just focus on what you're currently doing in the classroom. Focus on what we could do different. All right, how can we enhance our health practices so that we can maintain a healthy environment for our children and for all of the adults. Okay, so think outside of the box right here. First thing, setting aside toys and equipment that are placed in children's mouths or otherwise contaminated by bodily secretion to be sanitized before handling by another child. Now, if you're working in a toddler, young 2-year-old classroom, and remember children putting toys in their mouth, all right, that is a natural instinct. It's one of the first ways children learn to explore. Their brains are wired to explore by putting things in their mouth. So we want to keep the children safe, but at the same time, know that this is normal. All right, we don't want to shame or belittle the child for this practice. They're just doing what their brain is wired to do. All right, this is why we focus so much on choking hazards and making sure that you don't have choking hazards in these classrooms, especially in those infant, toddler, and 2-year-old classrooms, because things are going to go in their mouth. That is what they developmentally do. But if they do put something in their mouth and it gets a bodily fluid on it, you've got to let them do their thing in a safe manner, and then you've got to set that aside before another child uses it. With that being said, it is recommended to make sure that you have enough toys in your classroom that you can keep a steady rotation. All right, you've got a bucket over here or a dish pan. As soon as the child gets done, putting this toy in their mouth, you put it in the tub to be sanitized. But at the same time, you've got another set of toys and equipment over here that you can put back down so the next child can play with it. They don't have to wait for you to sanitize. So keep enough toys separated, all right, that you can keep that steady rotation. We always want to make sure that the children have enough items to play with to keep them engaged. And if you've got a giant bucket full of toys that need to be sanitized and there's nothing left for the children to play with or to be engaged with, you're going to start having some trauma. Trauma, yes. You're going to start having some drama. That's what I meant to say. Trauma works too, all right? So keep that steady rotation. And, and I really want you to challenge yourself on, what are some bodily fluids that children could come into contact with each day? What are some bodily fluids that you come into contact with each day? We've got saliva, we've got mucus, we've got urine, we've got poop, we've got blood, we've got sweat. The list just goes on and on. So there's a lot of opportunities for adults and children to come into contact with bodily fluid. And then really kind of challenge yourself, what toys, equipment, and furniture could get bodily fluid on it. It's not just the toys that the children are playing with, but think outside the box right here. The back of chairs when children are pulling out chairs, doorknobs, faucets whenever they're washing their hands, outdoor play equipment, common areas. I mean, the list just goes on and on of different furniture, equipment, and toys that children could get bodily fluid on. And you need to have a good process for sanitizing these items throughout the day. And yes, that does include your playground equipment. This is where most illnesses are shared. This is where cross-contamination takes place the most. Just because that playground equipment is outside, and one classroom, uses the playground, and then another classroom comes outside. If there's bodily fluid on that slide, if there's bodily fluid, on the things that they climb on, there could be cross-contamination. So you might want to come up with a good process for sanitizing these pieces of equipment after each group of children as well. It's going to take time, but it is a good health practice. You're going to see here it says machine wash cloth toys at least weekly and when contaminated. Again, think outside of the box on this one. What types of cloth toys do you have in your classroom that needs to be machine washed? Whether it's puppets, it's the home center clothes, it's soft books, anything like that. We need to have a good process for keeping these in compliance. Machine wash all linens at least weekly and when soiled or before it is used by another child. Now this is probably going to be one that you're going to exceed on. Machine washing linens at least once a week kind of seems nasty to me. So you're probably going to wash these more often, but definitely as needed or before another child uses it. And then sanitizing sleeping equipment before a different child uses it and when soiled. Once again, I know a lot of you are sanitizing your sleeping equipment every single day, even if the same child is using it day after day. You have your cots or your mats labeled with the child's name, so the same child is using that, every single day. I know a lot of you are exceeding on this one, and you're still sanitizing that equipment every single day. I think that's a good idea. Kind of going on, if you are using potty chairs in your program, potty chairs must be sanitized after each child's use. I know a lot of you have the smaller toilets that are built into your bathrooms that you're using for potty training. Same thing, especially during potty training time. Make sure you've got a good process for sanitizing that before another child uses it. Very, very, very common that bodily fluid is going to get on those toilet seats or on the potty chairs, especially in potty training situations. If you have a water table in your classroom, emptying the water table and the toys that are used in the water table daily sanitizing, and ensuring that the children and the caregivers wash their hands before using the water table. So that's probably a really important one right there. I see this missed quite often, is that if a child goes over to a water table, they don't wash their hands first. So make sure you're doing that, because if they don't wash their hands and then they stick it into the water table, they just contaminated that entire water table. So make sure you've got that practice going on as well. If you have sandboxes in your program or on your playground, make sure you're maintaining your sandboxes and sand tables if you are using that in a sanitary manner. We don't see a lot of sandboxes on playgrounds anymore. It's kind of an old school thing. It's kind of sad because it's a wonderful experience for the children. But if you do, still have sandboxes, make sure that they are maintained in a sanitary manner. And in this last bullet point on this slide, making sure that all garbage is inaccessible to children and managing it to keep the child care center inside and outside free of insects, rodents, and offensive odors, and disposing of it accordingly to local and state requirements. This is going to be another one where your city and your county may have different requirements for disposing trash than the state. So you want to check in your local area what those expectations are. But the big thing right here, make sure that your garbage cans have lids. All right. Under federal guidelines, any garbage can that bodily fluid is placed in must have a lid. Okay, well, you kind of think about that. What are things that we throw away throughout the day that could potentially have a bodily fluid on it? Well, in an early education setting, pretty much anything. All right, so make sure that those garbage cans are inaccessible to children. Having a lid on it, that's going to take care of that. Continuing on down this list right here, making sure that you're keeping all floors, ceilings, and walls in good repair and clean. Paints that are used in your center are lead-free. Make sure that you're really paying close attention to the wall that is behind the trash can. That's where I typically see deficiencies right here, is that when people are throwing things away, they're splashing, and the milk or the juice or whatever it is that you're throwing away splashes onto the wall, and it just gets really dirty and nasty, and even sometimes insects. So make sure that you've got a good process for keeping that nice and clean, so that you're in compliance there. Making sure that all parts of your program used by children are well heated, lighted, and ventilated. We want some fresh air moving around that classroom when it is safe to do so. Sanitizing tabletops, furniture, and other similar equipment used by children when soiled or contaminated with matter such as food, body secretion, those type of things. And again, make that list of other similar equipment in your program that children have access to that may be contaminated with a bodily fluid. Think outside of the box right here. Make sure that your cleaning supplies are clearly marked and that they are kept separate from food and that they're inaccessible to children. Okay? I see this happen all the time. I go into classrooms to do observations or assessments or validation visits, and I see, chemical bottles sitting on a table in the classroom. That's a deficiency right there. They need to always be out of reach of the children. And then, like we mentioned earlier, you're using, storing, and disposing of hazardous materials recommended by the manufacturer. So always make sure whatever chemical that you're using for sanitizing and disinfecting, you're reading those instructions and you're following them exactly as listed. Just a little bit of some research right here for you. I thought this would be helpful to help you maintain a healthy environment in your school and reduce the spread of illnesses. Research does support preventative steps to help limit the spread of infections such as regular hand washing, ventilating rooms regularly with lots of fresh air, and establishing cleaning routines. Germs have a very difficult time growing in clean, dry, and well-ventilated environments. If you've got windows in your classroom that can be opened in a safe way, that's going to get that fresh air flowing right there. Now, I've always had this rule in all of the schools that I've operated. Windows are only opened when there is a screen that's on that window. If there is no screen, then the window is not open. We don't want children climbing out of windows. So that's always been my golden rule right there. Contamination of toys and other objects in the classroom can contribute to the transmission of diseases and germs in operations. Once again, providing enough toys to rotate through the cleaning process allows children to stay active while maintaining a healthy environment. So this is where I was talking about using those disinfecting tubs, those dish pans, whatever works best for you. You've got an adequate amount of toys that as you're putting toys in your disinfecting tubs, you've got another set of toys that can go down for the children to play with. And you've got that nice steady rotation, so that the children can stay engaged. Let me go back up here to the ventilating of the room and keeping fresh air in the room. Whether you've got windows open or you've got windows closed and you've got the air conditioner on or you've got the heater on, y'all, your classroom should be a comfortable temperature for the children. All right? Not a comfortable temperature for the adult. I have been in so many classrooms where I walk in and it's like 50 degrees and the kids are all shivering and turning blue and their teeth are, and I'm like, why is it so cold in here? And the teacher's like, oh, I'm so hot. I keep turning the air down because I'm hot. Well, your children are freezing, all right? We need to find a comfortable temperature of the room for the children and the adults equally, but it shouldn't be all about you, okay? If you're freezing the kids out or the kids are hot and sweaty, you got to find that balance right there. You can reduce chemical exposure and asthma triggers inside the child care center by, selecting fragrance and dye-free products for cleaning and sanitizing. There are certain cleaning smells that are a trigger for me, for sure. And if it's a trigger for me, it's going to be a trigger for some of the children too. Ensuring adequate ventilation when cleaning once again, and using chemicals that may produce fumes or irritants when children are not present. Okay, so if you are using one of the, there's some bombs out there that you can get, that you bomb your classroom at the end of the day to get rid of some of the germs or illnesses that you might have floating around. You want to do that at the end of the day when children are no longer present, all right? Any of those fumes or irritants that, may trigger someone, okay? You might want to do that when the kids are outside at the end of the day, those type of things. I'm actually doing a training in a couple of days on supporting children with special care needs. And we're actually going to talk about this in that particular training, that, with autistic children, there are certain smells, there are certain fumes that will trigger them, okay? We need to be sensitive to that for sure. Listed here on the screen now are times that employees must wash their hands. So make sure that you're looking at this list really well. And I want you to be honest with yourself. Are you washing your hands every single time that you're supposed to be washing your hands? So we look right here. Before eating or handling food or medication, that's both your own personal food or medication, or if you're assisting a child with food or medication. before feeding a child, for those of you in the infant room and toddler room, after arriving at the child care center. Y'all might want to highlight that one right there. It's one of the most common deficiencies in this book, all right? The moment you arrive at your facility, okay, the very first thing you do is wash your hands, all right? If you're working in one classroom and your director gives you a different job assignment and they send you to another classroom, when you move from one classroom to another, the first thing you do when you walk into that new classroom is wash your hands, okay? Directors and administrators, same thing goes for you. If you're walking in and out of other classrooms, all right, you need to be washing your hands every time you walk into a new classroom. We're going to be washing our hands all day long, all right? You should be sick and tired of washing your hands, but that's what we've got to do to prevent the spread of illnesses. After you diaper a child, even if you're wearing gloves, you're still going to wash your hands after that diaper change. After assisting a child toileting, so those of you that are in potty training classrooms, okay, once again, even though you're wearing gloves, you still got to wash your hands right there. After your own personal toileting, so I know that when y'all go to restaurants, when you go to bars, you always see the sign, employees must wash their hands before returning to work. Y'all, it's no different for us. After your own personal toileting, you need to make sure you're washing your hands appropriately before, going back into that classroom. After handling or cleaning bodily fluids, such as wiping noses, mouths, bottoms, tending to different sores, these type of things, washing those hands. If you're handling or feeding animals, if you have animals in your classroom, definitely you need to wash your hands after handling or feeding those animals. Hopefully, these are classroom pets and not random animals that you have running around on your playground. We're going to talk about that later on. But always make sure you're washing your hands right there. And look at this, after outdoor activities. So when you come in from the playground, not only should your children be washing their hands, but you should be washing your hands too. Not only are we maintaining a safe and healthy environment, you also get this opportunity to model to children the appropriate and fun way to wash your hands, because you're going to go in the classroom and you're going to wash your hands first. Hey everyone, look at me. I'm washing my hands so that we can have a safe classroom. Come join me, So you've got a great modeling opportunity right there. After handling raw food products, after eating, drinking, or smoking, and this is for you personal, right? If you've got a drink or you're eating with the children, smoking, you have to go out and take a smoke break. For those of you that are still doing that, make sure you're washing your hands whenever you return. After using any cleaners or toxic chemicals, and after removing gloves, all right? These are the times when employees must wash their hands. Now let's go and let's look at when children must wash their hands. Children 18 months of age and older, must wash their hands with soap and water. So this has to be done with soap and water. Before eating, before playing in a water table, after toileting or having their diaper changed, after outdoor activities, after playing in the sand, after feeding or touching animals. And this is where it gets a little bit different. Any other time that the caregiver has a reason to believe that the child has come into contact with something harmful, all right? So this is going to be different based on every single child. Now, I put the yellow box right here on the slide because I want y'all to specifically see children 18 months of age and older must always wash their hands with soap and water. Children under 18 months, we're going to talk about that in a couple of slides and how you're going to wash those children's hands. But right here, 18 months of age and older and employees must wash their hands with soap and water. So let's see what the CDC says about hand washing. Research shows that the single most effective practice that prevents the spread of germs in a child care setting is good hand washing by caregivers and children. Look at that one. Read that again. All right? The best thing you can do in your program to prevent the spread of illnesses is proper hand washing. Okay? See how easy this is? It all comes down to just proper hand washing. You'd be surprised, okay, how healthy your program will be with just good hand washing. Rubbing your hands together under running water is the most important part of washing away infectious germs. Deficiencies in hand washing include sharing basins or sinks, sharing those bodies of water. That has contributed to many outbreaks of diarrhea amongst children in child care settings. So children wash their hands one at a time, and they don't share basins of water or sinks of water. You should be washing hands with running water, okay? I was actually in a classroom not too long ago where the teacher just had a dishpan of soapy water, and she was having the children put their hands in the tub and, yeah, that's not cool, all right? Because you're just cross-contaminating everyone at that point, all right? So we kind of had a coaching moment. Hey, let's pour that out and let's use the actual sink with running water. Here are the recommendations for proper hand washing from the CDC. And I recommend posting this in your classroom. Turn it into a visual for your children. So take pictures of the children following these steps in order. And for some children, if you've got some children with special care needs, if you've got some children with some challenging behaviors, create their own visual with that particular child modeling these steps that they can look at, they can see, they can touch it. But visuals never get tired of reminding us what to do. That's the great thing about visuals. But you can see here, wet your hands with clean running water and apply soap. Rub your hands together to make lather and scrub them well. And be sure to scrub the back of your hands, between your fingers and under your nails. Continue rubbing your hands for at least 20 seconds. If you want to sing the happy birthday song twice, or the ABCs, or I know a lot of teachers come up with their own song that is related to their classroom theme or their school family, fantastic. All right, you can sing that for 20 seconds if that is helpful for you. Rinse your hands well under running water. Dry your hands using a clean towel or air dry. And use a paper towel to turn off the faucet. And that last one is the step that I see a lot of people missing. All right? But if you wash your hands and you do everything the way you're supposed to, and then you reach over and you turn off the faucet without using a paper towel, you just recontaminated yourself. Okay, you just recontaminated yourself. So make sure that we're following that last step right there. When we talk about the appropriate use of hand sanitizer, you can only use hand sanitizer on children 24 months and older. Okay, so under no point in time can you use hand sanitizer for children under 24 months. You do not use hand sanitizer to wash hands that are visibly dirty or greasy or have chemicals on them, unless you are away from the classroom and soap and water is not available for hand washing. So if the hands are visibly dirty, have to be done with soap and water. Now, if you're outside on the playground, if you're on a field trip, and you don't have access to soap and water for children older than 24 months, at that point in time, hand sanitizer can be used. You're going to follow the labeling instructions for the appropriate amount to be used and how long the hand sanitizer needs to remain on the skin surface to be effective. So be familiar with the particular type of hand sanitizer that you're using at that moment. Don't supersize it. You know, sometimes again, when we want to try to control the spread of illnesses, our brain wants to supersize things. Make sure you're following the labeling instructions for that particular hand sanitizer that you're using, okay? You might be surprised at the number of hand sanitizers out there that say do not use on children. So be aware of that. Children have adult supervision when using hand sanitizer, so you have to be managing this. You cannot have a child that has a little thing of hand sanitizer that mom put in their pocket, and mom tells the child, you know, use your hand sanitizer throughout the day. That is not acceptable right there. This has to be supervised and managed by an adult. And then look at this one. You are storing the hand sanitizer out of the reach of children when it is not in use. So again, if you're on that field trip, if you're in an after-school program, I've even seen this in pre-K classrooms where children have hand sanitizer in their pocket, you know, that mom or dad or guardian put in there. No, it has to be out of the reach of children when not in use, okay? Probably the big point right here, soap and water is your friend, all right? I would not get into the use of hand sanitizer unless it's absolutely necessary, okay? If soap and water is not available, you know, that would be the only time. All right, let's talk about washing infant hands. Now, this is going to look and feel a little bit different for you right here. An infant, you know, they typically do not have muscle control in the back of their head and their neck. And it's very, you know, difficult, and it could be dangerous to raise them up to a sink. They may not be able to be raised up to a sink developmentally. So in these types of situations, we've got some specific expectations that need to be followed. So until the infant is old enough to be raised to the faucet for the water, you must wash the infant's hands using an individual cloth or disposable towel with soap, followed by a cloth or a disposable towel to rinse it with clear water and dry. Okay? Use soap and running water when the infant is old enough to be raised to the faucet and reach the water, or any other time that the caregiver has reason to believe the infant has come into contact with something harmful. So as soon as that infant does have muscle control of their neck and their head, you've got to be using the sink, okay, with the running water. We've done it with squirt bottles, that we've got squirt bottles with soapy water in it, and then we've got another squirt bottle with clear water for rinsing, and we'll kind of spray it on the infant's hands, rub it together, start getting them used to the sensory development right here, and we'll be able to rinse it with the clear water. That has worked really well. It's meeting these expectations. But as soon as they are old enough and developmentally, they've got the muscle control to be held up to the faucet, you've got to start using that, or doing it that way. Baby wipes can be used for infants that do not have the muscle control to hold up their head and reach the water. However, the baby wipes must state that they are safe to be used for infants and must be discontinued once the infant is able to be raised to the faucet and they can reach the water. Okay, so once again, whatever baby wipe that you're using, make sure you're reading the labeling instructions, make sure that the criteria is met. But as soon as they have the muscle control To be able to go to that sink, be held up to that sink and reach the water, you've got to start doing it that way. Diaper changing. Man, this is that fun time right here where we have a lot of illnesses that could be spread. So it's really important that we're following proper diaper changing techniques. And y'all, please remember that when you're changing a diaper, have a pleasant attitude, you know? Even if you're changing that diaper and it has loose stool and it's the stinkiest, grossest thing you've ever smelled and seen in your life, you gotta keep a pleasant attitude. If you start making faces and going, oh, you know, I want you to see that from the child's point of view, all right? The child doesn't understand that they have loose stool or stinky stool. All they're seeing is your verbal and nonverbal responses to them on that diaper changing table during that, what is supposed to be an intimate moment, all right? So you're really doing some damage to their self-esteem. You're doing some damage to their self-worth whenever you're making those negative, you know, sounds or the nonverbal communication during diaper changing. This is where, even if it's the smelliest, grossest thing you've ever seen or smelled, you keep a nice smile on your face, you keep the positive energy, you keep the positive intent, because we want the child to have that healthy self-esteem. So when you're doing a diaper changing, caregivers must promptly change soiled and wet diapers or clothing. So I know a lot of you say, well, we change diapers every 2 hours. Well, that's fine to do diaper checks every 2 hours. But as soon as that child has a soiled or wet diaper, they need to be promptly changed. You can't expect that child to sit or lay in that dirty diaper for 2 hours. That is not acceptable, all right? They're gonna get infections, they're gonna get rashes, they're gonna be cranky because it's uncomfortable. That is just not acceptable at all. Thoroughly cleanse a child with an individual cloth or disposable towel. You must discard any disposable towels after use and launder any clothes before using them again. Ensure that the child is dry before placing on a new diaper. If the child must be dried, you must use a clean individual cloth or disposable towel to dry the child. Once again, we want to avoid rashes, we want to avoid infections, so make sure that child is nice and dry before you put on that new diaper. You must not apply powders, creams, or ointments or lotions unless you obtain the parent's written permission to do so. If the parent provides these items, then permission is implied, and you do not need to get the written permission at that point. This is going to be one area where I recommend that you exceed the way I've always done it in the programs that I operate. We always get the written permission to apply a powder, cream, or ointment or lotion. Even if the parent brings it in, we still get the written permission. That's just good best practice right there. Make sure that you're labeling powders, creams, ointments, and lotion with the individual child's name. And that's the only thing that needs to be on it, is the individual child's name. And then make sure you're keeping all diapering supplies out of the reach of children. You must have a diaper changing table or surface that is smooth, non-absorbent, and easy to clean. This can either be above floor level or at floor level, all right? As long as it is a changing table or surface that is smooth, non-absorbent, and easy to clean. You must not use other areas that children come into close contact with during play or eating, such as dining tables, sofas, floor play areas for diaper changing. So you can't sit there and change a diaper right there in the middle of circle time, all right? That would not be acceptable definitely not going to throw a mat down and change a diaper on a table that a child is going to eat at an hour later. Okay, that's not acceptable right there. If the diaper changing table or surface is above floor level, then at all times when the child is on the diaper changing table or surface, there must be a safety mechanism that is used. Okay, the caregiver's hand must remain on the child at all times, or the caregiver must be facing the child and be within an arm's length. My recommendation on this one is to change the or to an and. All right, and this is what I've always done in the programs that I operate. We change the or to an and. There must be a safety mechanism that is used. The caregiver's hand must remain on the child, and the caregiver must be facing the child and be within an arm's reach. That's what I've always expected right there. Also keep in mind that you must have a hand washing sink in the diaper changing area so that once you change that diaper, you can easily access a hand washing sink for both the caregiver and for the child. So that needs to be in that general area as well. Again, I'm just going to go back to this when we talk about, 3-year-olds that are not potty trained, and we got to be really careful because not moving a child into a 3-year-old classroom because they're not potty trained could be a violation of the Americans with Disability Act. You got to be really careful doing that. I know a lot of schools that say, well, we don't transition children into the 3-year-old room until they're potty trained. You need to be careful because that could be a big ADA violation right there. Especially if the reason why that child is not potty trained is due to a disability. All right. But sometimes when I ask why, what is the purpose? What is the intent of this policy? Well, we don't have a diaper changing table in our 3-year-old classroom. You don't have to have one, all right? As long as you've got a surface that you can change a diaper or, clean up a child that is smooth, non-absorbent, and easy to clean. There is nothing that says you have to have a diaper changing table, all right? So be careful with that. And, when we talk about potty training, the best way to get a child potty trained is peer pressure. When they see their other children, their friends, when they see the other children doing it, they're going to be likely to do it as well. I have a really good book that I can recommend to y'all. Those of you that are working in a potty training classroom, shoot me an email or shoot me a message. I can send you the title of a really, really good book that just recently came out on potty training that is like a game changer. It's really, really good. When we talk about preventing the spread of germs in a diaper changing area, again, there's that good hand washing once again. So you must wash your hands. You must wash the infant's hands or see that the child's hands are washed after each diaper change. If you are using disposable gloves, you must discard them after each diaper change and wash your hands with soap and running water. Caregivers with open wounds or have an injury that prevents them from washing their hands, such as having a cast, bandages, braces, they cannot change diapers. All right, if you cannot properly wash your hands, then you need to be relieved of those duties right there. You must sanitize the diaper changing surface after each use. However, if you are changing diapers on a number of children consecutively, then you may cover the surface with a non-absorbent paper liner that is disposed of after each diaper change. Okay? You must cover containers. You must use a covered container for soiled diapers and keep them in a sanitary manner, such as placing soiled diapers in individual sealed bags, making sure that those trash cans have lids on them. If you do have a soiled piece of clothing, whether it's cloth diapers or if the diaper leaked out onto the child's, pants or shirt, they need to be sealed in a plastic bag and sent home with the child. A good recommendation that I have used in the past to help you prevent the spread of germs when diapering children is rotating 2 changing mats throughout the day, so that you're using one while the other one is being sanitized and it dries, all right? And to just kind of flip-flopping them. So having 2 diaper changing mats that, you can just keep them rotated, and that's going to speed up the process right there, instead of doing the process, especially if you're using a bleach water solution and you've got to follow that 5-step process. That's going to really slow down the diaper changing time. Alternating mats is a good way of speeding up this process and preventing the spread of germs and illnesses in the classroom. Because remember, the same time that you're changing these diapers, you also have to keep your children engaged in the classroom. So there's some talent right here, big time talent. All right, let's kind of move on, and we're going to talk about illness and injury now. Illness and injury. The first expectation that you're going to see listed in the child care minimum standards is that you must not allow an ill child to attend your child care center if one or more of the following exist. The illness prevents the child from participating comfortably in the child care center's activities, including outdoor play. Do y'all see that? And y'all, this came straight from the child care minimum standards. If a parent comes in and they say, I don't want my child to go outside today. Well, if they're too sick to go outside, they're too sick to be in care. All right? Give them a copy of this page in the child care minimum standards and say, hey, this is not my call. This is not my decision. It's the state of Texas. If they're too sick to go outside, they're too sick to be in care. The other really important piece of this standard that I really want y'all to look at, if the illness prevents the child from participating comfortably in the child care center's activities. Y'all, that's huge right there too. Sometimes when we look at illness exclusion, we get too caught up on like the temperature, he's got 100, he's got 101. And then you get into this argument with the parent that we don't know how to read a thermometer. And we said they had 102, but when they got them home, it was a 99. And you get into this nonsense. Y'all, move on, okay? Can the child comfortably participate in the child care center's activities? That's what we need to be looking at, all right? That's important right there too. Or if the illness results in a greater need for care than the caregiver can provide without compromising the health, safety, and supervision of the other children. And this is another one. Whenever I've had to deal with upset parents, when I've had to manage upset parents because of illness exclusion, I've pulled this page out of the minimum standards and used it. Look, I know that it's hard. I know that it's upsetting that we're having to exclude your child from care, but you've got to understand, I'm having to make a decision that is in the best interest of not just your child, but I'm having to make a decision that's in the best interest of all of the children, the employees, and the families in this school. All right? And sometimes having that child that has an illness that requires some extra attention, sometimes that creates a greater need for care that the caregiver can provide while, also caring for the other children. So we've got to look at that big picture right there. My recommendation, and I talk about this in a lot of my leadership trainings, in your parent handbook, one of the first things that needs to be listed is, our program is designed for well children. All right, you are not licensed to care for ill children. So be careful with that. You must not allow an ill child to attend your center if one or more of the following conditions exist. If the child has been evaluated by a healthcare professional, indicating that you can include them in the activities, that's fine. All right, so look at these right here. If there is an oral temperature above 101 that is accompanied by behavior changes and other signs and symptoms, so that would be putting the thermometer in the mouth. So you're going to look for that 101, and accompanied by behavior changes or other signs and symptoms of illness. If it's a tympanic temperature, so that's taking the temperature in the ear, that is a 100-degree temperature, again accompanied by behavior changes or other signs and symptoms of illness. And look at this right here. Taking a child's temperature in the ear is not recommended for children under 6 months of age. Okay, so be careful with that one. An auxiliary temperature, which is typically the armpit, all right, that's also 100 degrees. That is accompanied by behavior changes and other signs and symptoms of illness. And then the forehead, the infrared temperature of also 100 degrees, once again accompanied by other behavior changes and other signs and symptoms of illness. In any of those 4 conditions, you must not allow the child to attend your center unless they have been medically evaluated by a healthcare professional, indicating that you can include them in care. But that needs to be specific, all right? And we're going to talk about that here in just a little bit as well. You just can't get a doctor's note that says, you know, Johnny was seen in my office and can return to care. I need that doctor's note to tell me why, okay? Why can he return to care? And you know, you need to be a little bit more specific. Other signs and symptoms of possible severe illness could include the child being lethargic, abnormal breathing, uncontrolled diarrhea, 2 or more vomiting episodes in a 24-hour period, rash with a fever, mouth sores with excessive drooling, behavior changes, or other signs that may point to a severe illness. These are things that you want to be looking for right here. And keep in mind, when we talk about diarrhea and we talk about vomiting, there is a difference between diarrhea and loose stool. There is a difference between vomiting and spitting up. All right? We don't exclude children from care when they have loose stool and when they spit up. We exclude when they have diarrhea or when they vomit. All right? So you got to kind of know the difference between those two. And usually you can tell when it's diarrhea or vomiting by the smell. All right? The smell is the biggest indicator right there. All right? I do have a little note up here. If a healthcare professional has diagnosed the child with a communicable disease and the child does not have medical documentation to indicate that the child is no longer contagious, the child must not be allowed in attendance. All right? So in the event that the child has an illness, okay, you got to make sure you're getting that documentation from the healthcare professional on a communicable disease, stating that they can return to care. If it's an everyday illness, that's different. As long as they don't have the signs and indicators mentioned on this slide, everyday illnesses like cold and flu, those type of things, as soon as they're fever-free, symptom-free for 24 hours, they can return to care. But a communicable disease, you got to make sure you get documentation from the healthcare professional stating that they are well. When we talk about communicable diseases, you must follow the communicable disease exclusion requirements outlined by the Texas Department of State Health Services. I've got the website right here on the screen where you can review and download the communicable disease chart that is created by the Texas Department of State Health Services. I also have this on my website. So if you go to timthetrainer.com and you go to our documents page, you can review and download this communicable disease chart from my website as well. We added it because I know that sometimes it can be a little difficult to find this on the Texas Department of State Health Services website. So in order to help y'all out, we've put it right here on our website for you. When you do have a child that becomes ill in your program, here are the way you're supposed to respond to this. I'm losing my talking skills all of a sudden. I apologize. So responding to a child who has become ill. If a child becomes ill in your program but does not require immediate treatment by a healthcare professional, so in other words, the child gets sick, they have a temperature, they have signs and symptoms of an illness, or they have behavior changes, and you have to call the parent and have the parent come pick the child up, okay? So these are the steps you're going to follow. Contact the parent or guardian and tell them that the child needs to be picked up. And I recommend that you put a time frame on this. In your parent handbook, give them a time frame. If we exclude a child from care, you have 1 hour to pick them up, okay? Or whatever is reasonable for your geographical area. You're going to care for the child apart from the other children, and this can be done in the classroom. If your classroom is big enough that you can care for this child apart from the other children, maintain a safe and healthy environment, and make sure that you're still giving appropriate attention and supervision to both that ill child and the rest of the children in the classroom until the parent picks up, that's fine. All right? Give extra attention to hand washing and sanitation, if the child does have that diarrhea or vomiting, okay? I'm kind of a big person that I don't allow children in the front office unless it's an extreme circumstance, because there are too many things that go on in the front office that's not appropriate for children. There's too many conversations and behaviors that are not appropriate. But most importantly, if you were to have a significant event, so the fire alarm was to go off, if you had an intruder that walked into your program, and you've got a child sitting up in the office, that's not good, all right? So if you can care for that ill child in the classroom and give appropriate attention to health and safety and supervision, right? That is the best case scenario until that parent gets there to pick them up. Now, if it's an extreme illness, that's kind of a different story. If a child becomes ill while they are at your center and they do require immediate treatment by a healthcare professional or they need to be taken to the hospital, here are the steps that need to be followed. You're going to contact emergency medical services, so you're going to call 911, or if you've got authorization to transport, you can take the child to the nearest emergency room after you have ensured that proper supervision of the other children has been obtained. All right. Give the child first aid treatment or CPR if needed. Contact the child's parent. Contact the physician or healthcare professional identified in the child's record, and make sure that you're keeping up with supervision of the other children in the group. All right. So it's good to practice this, y'all. I always recommend role-playing and practicing these types of situations. If you've got 2 teachers in the classroom and you have a significant illness or injury, one adult is going to tend to the ill or injured child. The other adult is going to keep their focus on the rest of the class. All right? But you can't have both of those adults on top of this ill or injured child and then no one's watching the rest of the class. Our natural instincts want to kick in, and our natural instincts wants to go into, taking care of that ill child or taking care of that injured child. But this is why you've got to practice it, so that you've got good processes in place, that you're caring for one child while also maintaining the supervision and attention of the rest of the group. When can a child return to care? All right, so a child may return to your child care center when the child is free of symptoms of illness for 24 hours, or you have obtained a healthcare professional statement that the child is no longer has that illness or condition. And the note that you get from the doctor must specifically say that they are no longer ill, all right, and that they no longer have an excludable condition. Just getting a doctor's note that says Johnny was seen in my office and can return to care, that's not going to fly, all right? The note from the doctor needs to specifically say the child is no longer ill and no longer has any excludable conditions. I'm also going to recommend that you add to your policy manual that when a child can return to care, that the child must be free of symptoms of illness without medication for 24 hours. And add that in there, that they have to be free of symptoms without medication for 24 hours before they can return to care. A lot of times people want to try to mask illnesses with medication, and that's exactly what it is. It's just masking it, but the illness is still there, all right? And I'm sure we could tell a lot of stories about times that children have come into the classroom and they're like, oh, my mommy gave me medicine this morning. You know, I usually ask them, what color was it, right? Was it pink or was it orange? Because that's going to tell me if I've got 4 hours or 6 hours, you know, until the kid crashes and burns. You know, or the kid that comes into the classroom and I threw up this morning, you know, well, you know, just because they threw up at home, they still have to be symptom free for 24 hours. Nothing says it has to happen at the child care center. All right. So if they had the symptom at home, that's when the clock starts. Okay. So sometimes we have to do some parent education on that. Here is the immunization chart that is listed under state services. You can just kind of take a look at this and be familiar with what immunizations are required for the children here in the state of Texas. I have a whole separate training on immunizations that you can watch to get more information on this. It is the responsibility of the child care center to make sure that children who are in attendance are up to date with their immunizations, or if immunizations conflicts with their beliefs or convictions, then you can have a notarized affidavit on file, and that would be fine too. Right now, we're seeing a lot of children that are on delayed schedules on receiving their immunizations. That is fine too, as long as you have documentation from the healthcare professional that they are on a delayed schedule and that child is up to date with the schedule, then they would be able to be in attendance as well. Obviously, you need to be aware of when a child is receiving immunization so that you can look out for warning signs that they're having a reaction and they may need further medical assistance. So make sure you've got that open communication with the families so that you can look out for that, making sure that the children are safe. Again, if you want more information on immunizations, you can watch that specific training that I've got on my website, review that specific training, and that'll give you the information that you need. When we talk about medications, administering medications, it's a huge risk and liability to your program. If you are administering medication, you're taking on a big risk. Definitely make sure that you've got policies in your program on who is giving medication, where the medication is stored. If there are any medications that your center is not giving, those type of things. Like, for example, the policy that I have typically followed in the schools that I operate is that we will only give medication that is prescribed 3 or more times a day, and we will only give the middle dose. So, for example, if a child has a prescription medication that is to be given once a day, the parent can give that at home. Okay, there is no reason for you to take on that risk and liability when the parent can do it at home. Even if the medication says the prescription is given twice a day, the parent can give it before they bring them in. The parent can give it once they get home. Once again, there's no reason for you to take on that risk and liability in those situations. So that's why I say, only medication that is prescribed 3 or more times a day, and we're just going to give that middle dose. That's what I have typically followed in my schools. When we talk about administering medication, a medication could be a prescribed medication or an over-the-counter non-prescription medication. So that's what we're referring to right here. To get authorization to give medication, it needs to be in writing, signed, and dated. If it is in an electronic format, it needs to have the capability of being viewed and saved. Or if you're taking the authorization by telephone, you can do that for a single dose of medication. I would still recommend that you get it in writing as soon as you can. All right. Authorization to administer medication expires on the first anniversary of the date the authorization is provided. So these authorizations are good for 1 year. The child's parent may not authorize you to administer medication in excess of the medication's labeling instructions or the direction of the child's healthcare professional. So in other words, you have to administer that medication exactly as prescribed. Or if it's an over-the-counter medication, exactly as instructed by the manufacturer. The parent or guardian cannot change the dosage. All right? So you got to look out for that, because I've seen many cases where they've tried to do that. Okay? You do not need parent authorization if you are administering a medication to a child in an emergency situation that is preventing death or serious injury to the child. This is most commonly referred to EpiPens. All right. If it's an emergency, life-threatening situation, you're going to do what you need to do to keep that child alive and safe. We don't deal with this very often, but it could possibly happen in your program. When you are given medication, once again, you're going to give it as stated on the labeling directions, or you're going to give it exactly as prescribed from the healthcare professional. Medication must be in the original container with the child's full name and the date that it was brought into the operation. So don't forget to have that date that it was brought into the operation. And like I said, they can't bring it in a Ziploc baggie. All right? It has to be in the original container. I've seen it where parents have tried to put medication in a bottle, like an infant's bottle. Nope, that's not going to be acceptable either. Has to be in the original container. Has to be administered only to the child for whom it is intended to. So it can't be a sibling, it can't be another child, it has to be the child that it is prescribed to. And it can't be expired. So you got to look out for this. Make sure that parents aren't bringing in expired medication. When you are administering medication, you must record the following information: the full name of the child that you're giving the medication to, the name of the medication, the date, time, and amount of medication given, and the full name of the employee administering the medication. So this is what must be documented in these situations. Once again, I strongly recommend that you only have a certain number of designated people to give medications in your school. You want to limit the risk and liability of giving medication. We have our food allergy emergency plans that need to be followed. So a food allergy emergency plan is an individualized plan prepared by the child's healthcare professional. Okay, this has to be prepared by the healthcare professional, not the parent or guardian. It's going to list the food that the child is allergic to, what are possible symptoms or signs of a reaction of the food, and then what steps must be taken if the child has an allergic reaction. So this is what has to be included on your food allergy emergency plan. Okay, what food are they allergic to? What are signs of a reaction or that the child is going into shock? And what first aid must be administered? All right. I have seen many food allergy emergency plans posted in classrooms that say, we've got Johnny here. He's allergic to peanut products. If he gets a peanut product, call the office. Call the parent. Y'all, that's not first aid. All right. It needs to specifically state what should you do in the event that the child has a reaction or is going into shock. Okay. So make sure that your food allergy emergency plans are written correctly. And these are only for the children that have food allergies indicated by their healthcare professional. So you don't have to have a food allergy emergency plan on every single child in your program. It's only if they have a food allergy that has been indicated by their healthcare professional. Last thing we're going to talk about here is animals. If you do have animals in your program, we love it when you have animals in your program. I think this is great, but parents must be notified in writing when you have animals present in your program. You must ensure that the animal does not create unsafe or unsanitary conditions. So you got to keep those cages clean, right? That's a lot of work. Ensure that children do not handle any animal that shows signs of an illness. And ensure that caregivers and the children practice good hygiene and hand washing after handling or coming into contact with an animal and items that are used by the animal, such as water bowls, food bowls, cages, those type of things. You must have documentation at your center showing that the animal has been vaccinated if applicable. So if it is an animal that requires vaccinations, they have to stay up to date on that. Or you have to have a statement of health from the local veterinarian for dogs, cats, ferrets, and other animals other than small rodents such as guinea pigs, mice, hamsters, those type of animals. All right, so that statement of health from the vet, you need to make sure you've got that too. Children must not come into contact with chickens, ducks, reptiles such as snakes, turtles, lizards, iguanas, and amphibians such as frogs and toads. So all of those animals are prohibited in your program. Be careful when you have like a petting zoo that comes out to your school and they bring animals. You kind of need to look out. Make sure that the petting zoo is not bringing any of these prohibited animals. You must keep your child care center and the playground free of animals unfamiliar to you. And you must not allow children to play with animals unfamiliar to you or other animals that could be dangerous, including exotic animals such as monkeys. All right. So I know that not a whole lot of programs have animals, but they are really fantastic if they are managed correctly and they are kept in a healthy and sanitary manner. It could be very beneficial for the child. All right. Now this is concluding the video portion of this training, but you're nowhere close to being done with this training module. You're going to have your assessment and it's pretty long, y'all. I'm not going to lie to you. This assessment is pretty long, and it's going to take you some time to complete that assessment. But I specifically made it very thorough because the information that we discussed in this training is so incredibly important in maintaining a healthy environment and preventing the spread of illnesses in your school. So I really want to make sure that you're getting this material and that you understand it thoroughly. So the assessment is going to take you some time. That's not the only other thing I want you to do. I want you to take this material that we covered in this training, and I want you to match it with your policy manuals and your processes that you're following in your school. Have conversations with your center director. Are you in compliance? Where are there opportunities for you to grow? Where are there opportunities for you to enhance your health practices? And this is not just the responsibility of the center director. This is a team effort. It's the power of unity. We are all in this together, and we all have to work together as a school family to maintain a healthy environment. So you can't just say, hey, I watched Tim's video and he said that we should be doing this and this and that we should not be doing this and this. Director, you need to take care of this. That's not how it works, all right? We are a team. We are a school family. And you're going to take this information, and especially if you do have suggestions on how you can make your program better, or you see areas of improvement, and together as a school family, you're going to move your school forward, all right? And hold each other accountable. If you see another teacher that is not following proper health practices, all right, hey, I noticed that you didn't wash your hands whenever you came in from the playground. That is an expectation outlined in the child care minimum standards. What can I do to help remind you to wash your hands whenever you come in from the playground? All right? Y'all be there for each other. Support each other. Encourage each other. But if you see somebody in your facility that is not following a health practice, if you don't say anything, you're just as guilty as they are. All right? So we got to work together as a team, because I'm sure you would agree with me. This was a lot of information. This is a lot of expectations. It takes a lot of practice to get all of this down. We need each other to hold us accountable and to help move us forward. All right? So please, take your notes that you took today, take this information, have those conversations with each other, have that conversation with your leadership team, go into it with positive intent. All right? It's not about pointing out who's wrong. It's not about pointing out who's not doing their job or they're not doing this or that. It's about how can you work together to move your school forward. That's what it's all about right there. Okay? So again, if you have any questions about any of the training material discussed today, send me a message on our website, give me a call, shoot me an email. We will return your call or your message or your email in a timely manner. Or if you need more information beyond the scope of the training material, reach out to me. We are here for you. All right. I hope this video was helpful. Hopefully you had your copy of the child care minimum standards and you are following along in the standards. If not, everything we talked about today is right here in the standards. You've got that. Okay. Now it's your turn to go back into your classroom and maintain a healthy environment. And now it's your turn to prevent the spread of illnesses and show those families, show the community that we are a healthy environment and we have the children's health as one of our #1 priorities. Now it's up to you. All right, everyone. See everyone very soon. Thanks for taking this training today.